An important warning today for women as healthcare providers make new discoveries about lung cancer, especially in non-smokers. We have what one wife and mother wants you to know in today's Medical Edge.
The next morning I woke up with a upper left side pain.
It was a day after moving a few boxes where she thought she pulled a muscle. That eventually led Toni Coleman here to Dr. John Morris's office. She came in with her husband after imaging tests showed what was eventually diagnosed as adenocarcinoma of the lung, stage 3A.
What that means is that you have a tumor in the lung, but it is spread to lymph nodes in the center of the chest, but on the same side.
We were really terrified. You know, you face death.
What might have made all the difference, however, for Toni was that she was eligible to participate in a clinical trial. Researchers now are looking at newer ways to treat lung cancer before surgery.
That trial included a newer drug called panitumumab, a drug which seems to...
Monoclonal antibodies recognize very specific proteins on the surface of cancer cells. They bind to them and they do multiple things, including the immune system attack those cells.
The drug also, along with other treatments, may stop cancer cell growth in the body. And for Toni, following surgery...
At this time, she has no evidence of any disease.
But part of the concern for Dr. Morris...
She was a non-smoker, and we're seeing increasing numbers of patients, particularly women. It's become an issue who are non-smokers who are being diagnosed with lung cancer.
Nobody is quite sure why, but Dr. Morris says hormones may play a role in that. What's more, he says, is that in women who do smoke, there's a higher rate of lung cancer than men who consume the same amount of tobacco.
And the reason for that is thought that the metabolism of the carcinogens is different between men and women.
Now, if you would like more information on this clinical trial that we talked about with Toni or another one, we have information from the UC Cancer Institute at 513-584-7698. You can also attend a free lung cancer seminar on Saturday. All the details for that are at local12.com. Just click on the red Get It button. You know, a lot of the problem was that this cancer did not have a lot of survivors until they started making these newer discoveries. So they need people in clinical trials, and they need people like Toni who are willing to talk about it.
Yeah, thank you, Liz.